Hi guys, it's Dr. Becker. I'm back to talk about what happens to your voice when you get older. And by the way, when I say older, I don't mean like necessarily really old. This is when I'm talking about age-related changes of the larynx, I really am talking about things that start happening in middle age, even in our 40s, and sort of continue on through our 50s, 60s, 70s, and beyond. I will preface by saying that the changes in the larynx are somewhat universal, kind of like graying hair, but they do happen to people at different ages and to different extents. So by the time we're 100, most of us, if we're lucky to live that long, we'll have voice change. We will sound like a 100-year-old person. But when we go through the change to that sound is very individual for different people. I will say kind of like when your eyes change in your 40s and early 50s, that is the time for eyes that most people experience changes in their vision, in their close vision. And that has to do with the natural way that our lens and our eye stiffens over time. The similar changes happen in our larynx. They just happen a little bit later than with our eyes. So most people notice changes in their eyes, in their 40s or maybe early 50s. And I would say the biggest age about that I talk to people about laryngeal changes of their voice is probably in the early to mid 70s. Now that doesn't mean that that's not happening before that time of life, but I think the time that it is the most noticeable, people start to come to me and say, I don't sound like myself. I sound like a different person, is usually, around age 74 or so. And it's the same time sometimes those same people will experience difficulty with singing if they were a singer. And there's very normal anatomic reasons for that to happen. And the good news is that actually there is some help for it, that voice therapy can actually be an incredible asset to people who are not ready to just have their voice come out however anymore. So there's a little light at the end of that tunnel. I mean, we can't really turn back time and create a young larynx in an older person, but we can teach that person how to use their voice a little bit differently so that it's a little bit more effective and a little bit more under their control. So let's talk about what happens when our vocal folds age. So hopefully, I'm assuming with this video that you either understand how vocal folds work or that you watched my first video, How Your Voice Works, just to understand how the vocal folds create our voice. And I'm going to use my example again of a rubber band for the vocal folds. So remember, the vocal folds need to be able to vibrate at a regular period, a regular interval, in order to create a tone, a voice tone, E. And a voice tone is what we hear as a normal voice. If our vocal folds do something other than vibrating regularly, say if they just flap or flip and like a flag in the wind, if they just flap, they will sound more like a buzz, like this. Rah, rah. We call that vocal fry because I don't know why we call it that. To me, it's just because it sounds like something frying, rah, like those little bubbles and pops that happen when you like fry some bacon or something. But the vocal fry is what a lot of people are complaining about when they get older. They go to get up in the morning and they start to talk and their voice sounds all like this. They say they sound craggy, they sound froggy, they sound raspy, and they don't get the tone E out of their voice box. They just get that vocal fry, that raspy tone coming out when they come to speak. So why does that happen? I will tell you. When we're younger, nobody teaches us how to talk. We just do it, right? We're babies, we're screwing around, we do something here and the voice comes out and we go, oh, that's good. And then we reinforce that behavior in our brain. It's a motor pattern in our brain. And when we go to talk, it just comes out. So when we're doing that, we're not thinking about it, but when we're talking, we're setting the muscles of our larynx in a certain place, like a vocal posture, if you will. we're setting the vocal folds, we're taking a deep breath, and we're pushing the air out between our vocal folds, and they vibrate to create our voice, right? So when we're younger and we have a super elastic set of vocal folds, where we set them is perfect to create a nice vibration. But what happens when we age, as most of us know, is we lose elasticity in our tissues. So the elastic qualities of our tissues goes down throughout our life. That's why we get wrinkles. That's why things sag. So our vocal folds actually undergo that change as well. So the vocal folds, when we go to talk the same way we did our whole life, we go to set our vocal folds in order to make a sound, all of a sudden the vocal folds are saggy. So they're not tight as they used to be. They're a little bit lax or loose and a little bit stiff, so they don't vibrate as easily. What that means is that the same motor function that we've been doing our whole life all of a sudden isn't quite right to create the voice that we're used to hearing. So what happens is the vocal folds, instead of being tight and being able to vibrate, they're loose and they flap instead. They flap like a beach blanket or a flag or something and create the vocal fry. That's what happens. So what older people will notice too is that sometimes their voice sounds craggy, but other times it's maybe not that bad. Or there'll be moments, especially when I'm examining people and I ask them to do an E sound, which is the tone that we always use to create a nice vocal fold vibration. It puts the throat in a nice open position so we can see the vocal folds really well. So we always ask people to say E during our examination. Well, it's very common that when I'm looking at a person with an aging voice, that during the examination, their voice actually sounds great. So they'll come in and they'll say, my voice is really craggy. It's like really raspy all the time. And then I go, okay, say E, and they go E, and out comes a beautiful clear E. And what's happening there is that they're using a different motor pattern to say the E, more like a singing pattern than they're using to talk. And all that needs to happen is they need to sort of get trained to break into that different space where they can create a better voice. It's actually kind of hard to change the way you talk. It takes a lot of effort, but it's nice, to know that there's an option. So with folks with an aging voice, there's really two really fundamental keys to making it better. And these are things that the vocal therapist will teach very well. And I always recommend that people with an aging voice who are bothered by it do go and get at least a few sessions of some instruction from a vocal therapist who is, by the way, a speech and language pathologist who's specially trained in the function and disorders of speech and swallowing, so mouth and throat. They're like physical therapists for your larynx, the voice therapist. It's a subspecialty of speech therapy, but they understand a lot about vocal production and what you can do to improve the efficiency and sound of your vocal production. So a lot of my patients with various problems, mostly problems with function or overuse, misuse of the larynx, will spend some time with a speech language pathologist or voice therapist to improve their behaviors and also learn better ways of creating their voice that's more functional and efficient for them. So that's no different in the aging voice because there's some instruction that needs to happen with regards to like better ways to create your voice, to warm it up and things like that, so that when you go to talk, you'll sound more like yourself. So there's just a couple, this is not a substitution for speech therapy, but I would just say that the couple of, just by way of motivating folks to go, I will explain what it is that they sort of do to focus on for the aging voice. The first is breath support. Okay, breath support's really important. As I said in my first video about this topic, your lungs are the powerhouse for your voice. They create all of the energy and power that goes up into our throat to create vocal fold vibration. So if you're trying to breathe, if you're trying to speak with like this much air in your lungs, it's not going to work. It's actually the reason too that vocal fry creeps into a lot of our speech, even in middle age. So for instance, I'm finding a lot of my friends will start to creep in at the end of a sentence the vocal fry will come in. So they'll be talking and they're running out of air, and they're running out of air, and they're running out of air, and they get down in this place where the voice, when I'm trying to talk without any air, it's really hard to get normal voice, and it starts to get more froggy at the end right there. See how it went down into the buzz? So when there's not a lot of air to support the vocal folds and stretch them across the vocal, the glottis where the vocal folds live, if you can't like stretch and support those vocal folds and they sink and sag, they're going to sound like that vocal fry, okay? So breath support is super important. A lot of times speech therapists will work on increasing the amount of air we breathe in general by doing breath exercises, and also the amount of air we breathe during speech. It's really better to take a nice deep breath before you try to speak, and that's going to make your voice sound better when it comes out. So breath support's a big one. The other one is proper pitch. So remember how I talked about how the vocal fold stretches when we increase our pitch and relaxes when we decrease our pitch? Well, it turns out that vocal fry, that buzzing that you don't like to hear in your voice, happens when our pitch is a little too low, right? So our elastic vocal folds, when we relax them too much, they do that flopping thing. Doesn't sound good. So the way to increase the vibrational quality of our vocal cords is to raise our pitch just a little bit. I don't mean that you should be speaking like Minnie Mouse all the time or try to change the way that you sound, because that would be silly. What I do mean is that you should try to find a pitch that's higher than this low one and speak on it. That's why sometimes when my patients say E in the office, it actually comes out a little better because they're choosing a higher pitch to sing that E than they would to speak it. So sometimes what the sometimes what the speech therapist will do is that they'll have you find a note that's like in your speaking range, and they'll have you practice kind of humming on that note to kind of set the muscles in a proper posture in here to create a tone to speak on that's actually going to sound better for you. So I will advise some of my older patients to kind of practice humming in their mid-tone and then trying to talk on that tone with a lot of air in their lungs to create a voice with a tone rather than a voice with a buzz like this. So that's my kind of short answer about the aging voice. Like I said, it can be challenging. Your vocal folds have changed, and so you're never going to be able to do exactly the same thing as you did before. But there's definitely hope to learn to work with your new voice, your mature voice, and to make it more under your control and more like what you want. So I, again, encourage you to just, if you're concerned about the sound of your voice, let us check it out. And if it's just age-related changes, then we can definitely refer you to a speech or a voice therapist who can really work with you and get you sounding better. So that's all I have to say about the aging voice. Thank you for watching, and I'll see you next time. Bye.